thank you everyone for joining our session today to hear about our early learnings from our new shelter-linked mental health program. My name is Dina Chou. I'm with the Office of Economic Opportunity at the Department of Human Services, and I focus on managing our funding for our Safe Harbor shelter and housing programming. And I'm joined by my coworker, Rabya Hassen, who focuses on our Homeless Youth Act funding. And we're also joined by three fantastic panelists who are providing these shelter-linked mental health services in their programs, and we'll introduce them in a little bit here. Okay, so we're just gonna, Rabya and I are gonna give a super quick background of what shelter-linked is. We're gonna introduce our panelists, and then we're really gonna spend most of the time allowing them to share with you what their experience has been implementing this program. And then we hope to have a little bit of time for questions at the end. So shelter-linked is a new program. There was a bill passed in the 2018 legislative session, and the goal really is funds were appropriated to allow for mental health services to be integrated into services programs for homeless youth, and also programs serving sexually exploited youth, which are mostly our Safe Harbor programs. This shelter-linked program was really modeled after the school-linked mental health program that has existed for a few years now. And again, with both school-linked and shelter-linked, the goal really was to get mental health services integrated into programs that already exist in the community or schools, and to really lower barriers to mental health services to folks that need it, to also, and those barriers exist, you know, for many reasons. Oftentimes it's because of maybe insurance reasons, also because of stigma, also because of other lack of resources like transportation or things like that. So, and we, of course, we all know working in the homeless field that mental health services are so important for stabilization and for success. So we were really excited when shelter-linked passed, and we were able to help our homeless youth and Safe Harbor programs start integrating mental health services and supporting them. And we know that lots of programs already are doing this to some extent, but shelter-linked, the goal is just to support that work to keep going. And I wanted to just acknowledge that shelter-linked is currently it's only for homeless youth and Safe Harbor programs. And so we hope that things that we share in this session, though, are helpful to all populations. But that's just what shelter-linked focuses on currently. And then I'm going to turn it over to Rabya, and she's going to talk more specifically about the activities under shelter-linked.
Great. Thank you, Dina. Good morning, everyone. It's so great to be here with all of you. In speaking about shelter-linked mental health, there were some eligible activities for these grant funds, and I'll be kind of discussing what 4 of those service categories include. So programming to prepare youth to receive mental health services. So this is really kind of the first step of integrating mental health services in homeless youth programs and Safe Harbor programs, by really allowing you know, conversations to happen around stigma and really lowering different barriers for young people, having the mental health provider actually be in the different shelter settings or housing settings. And then the second category would be on-site mental health services. So really having that mental health practitioner be integrated in all of the homeless youth services in the different provider settings. And then the third one is staff consultation and training. So really building the capacity of all the staff in these homeless programs, as well as Safe Harbor programs, because as Dina mentioned, mental health and homelessness are very much intertwined. So really being able to have staff consultation around that, as well as training for staff, is something that's really important. And then of course, all of the different supportive services to build up to youth being able to access mental health resources. So as we move into the next part of the presentation, I will do a quick introduction of the three amazing panelists that we have while we have their bios on the background that you all can read. If we move to the next slide, our first panelist is Hanna Kreusser, who is currently the Executive Director of Face-to-Face Health and Counseling. Face-to-Face Health and Counseling has a medical clinic, mental health department, as well as various homeless youth programs. And so thank you for being here, Hanna. Our next panelist is Christina McCormick. Christina oversees 3 residential programs, transitional living, 180 outreach, and membership and volunteer programs at 180 degrees. Thanks for being here, Christina. And then we have Emilie Ward, who is a wellness counselor with Lutheran Social Services in Duluth. She works with the Renaissance Transitional Housing Program and another door shelter program. So we'll kind of move into some of the questions that we have for the panelists. The first set of questions that we have are, what was the need that you saw for integrating mental health services, and how are you implementing shelter-linked mental health services? What are you providing? So we'll first start with Christina, and then Hanna can continue, and then Emilie will go last for those questions.
Thank you for having me. So for In 180 Degrees, we have 2 programs that we're able to have this grant, both a safe harbor and a homeless shelter. So we've kind of seen how we've worked with 2 providers to roll this out. The reason for the need was just barriers. For the youth that we serve, and that probably for a lot of the youth and young adults, everybody serves on this call and in this panel, that there's families in crisis. They're experiencing housing instability. There's a lot of crisis there. Our youth advocates that are direct care can do a lot of amazing things. They can meet basic needs. They can work with de-escalation. They're trauma informed. But when you're dealing with some of these high trauma aspects, you really need a mental health professional to be able to dig deep and be able to provide those resources. And that is why this grant was really essential for our program to move forward. And how we're using it, we, in both Brittany's Place and Hope House, we have 2 different providers, but we're working with 1 in each location. And they do youth mental health counseling, family mental health counseling. They do groups with the youth at each of the locations. They provide staff client consults, which have been huge resources for our staff to be able to walk through some diagnosis, how to best serve the youth that we work with. And then we're going to hopefully continue some of those groups to allow other young adults in the community experiencing some crisis as well to join those groups. And we're hoping that will be a next step.
I think we're going to pass it on to Hanna now.
Okay. Great. So good morning, everyone, and thank you again for having me. And as Christina said, what I want to really start with is just the need. And having worked in the shelter system for many years and really seeing what our young people need. The biggest challenge for the success of young people has always been about the underlying needs, or the reason for part of the reason for homelessness being, mental health and chronic mental health issues, and really not being able to address adequately, with shelter staff. And so that was kind of the challenge that we had seen. And really, I'm so happy to see this coming through as somebody really advocating for this funding. So I'm excited, and I'm really excited that Face-to-Face had the honor of being a grantee and to partner with 2 shelters, Avenues for Youth, as well as Andayang in St. Paul. So what we have been providing, one is in the starting period at Avenues, but at Andayang, we have been able to provide individual therapy, group therapy, as well as life skill training. And then, as Christina said, the staff training is really has been very beneficial for staff to try to process what they have seen, or find some alternative ways of dealing with the issues that they have seen. And so really again to really emphasize the need for this support is that the trauma, the complex trauma that young people come with us. Homelessness by itself is trauma, right? And so then there's complex trauma through their lives. It has been a major part of the need for our young people, as well as, like once young people get into a shelter, how do we normalize that experience? And also give hope. And I think this is where this is not the end. They're on the journey. How do we do that in a very intentional way? And of course, and since again, young people need some life skills, right? Is this the opportunity for us to engage at that level as well through the mental health path? So the needs and what we're doing are really in line with what we're seeing. And I think our partners are also been very helpful in making sure that we continue our presence in these shelters. Thank you.
Thank you, Hannah. Emilie, you're next.
Hi, everyone. Thanks for having me. Yeah, my name is Emilie, and I'm actually based up in Duluth through Lutheran Social Service. There are two programs that I'm working with that are run by Lutheran Social Service. One of them is called the Renaissance Transitional Housing Program. And so the youth there are ages 16 to 21, and they live there for up to a year and a half. And then the other program that I'm working with is Another Door, which is an emergency shelter serving individuals who are ages 18 to 24. And so the goal is for them to be there for 30 days, but oftentimes it's longer than that. And so they work with the individuals to find safe housing to transition to. And so thinking about the need that we saw for integrating mental health services, talking about, again, the demographics, the minority populations that are overrepresented in the homeless population, and then also LGBTQ identifying individuals as well. There's a lot of reasons why those individuals are homeless and overrepresented as well. And so going through, and like Hannah said, that trauma that homelessness leads to, just working with the individuals in a more intensive therapeutic way. Also, most of the youth in the programs enter without insurance. And so this grant has allowed that barrier to be taken down. The goal is that they will leave with insurance, but coming in, they might not have it, but then they can still get the mental health services. Also, social determinants of health have impacted their ability to get integrated mental health services in the past. And currently we're providing one-on-one therapy sessions, support groups, and trainings for staff on trauma and suicide prevention and awareness, and wellness activities for the youth. So that's kind of what we're doing right now. And yeah, we're really excited. So thank you all.
Great, thank you so much. I was going to share my screen again real quick, just to go over the next topics that our panelists are going to talk about, if my slide will change. Okay, so our next questions for the panelists are how ShelterLink has helped lower barriers to mental health services for the youth you're serving. And also if you could share some ShelterLink services success stories. And I think we're going to start with Hanna on this one.
Yes, thank you. I think what's really exciting about this, our ability to provide mental health services and shelters, is that there is just low barrier, right? Like access to mental health services. And they don't have to necessarily make an appointment, hop on public transportation, or go anywhere to really get the services. And I think, as in my early days at Alvin, as one of the young people had said, if, after so many attempts to kind of get her connected to outside resources, and her comment really really stuck with me. If you had those services here, I would go. And that just really made sense to us, because, having access to kind of wraparound services for young people is really important. So the low barrier piece is about, of course, access in terms of the distance, but more also about insurance. I think that the bigger challenge is trying to navigate how to have health insurance to be able to access mental health, and is a challenge for most of our young people. So just being able to just serve regardless of your ability to pay, and also navigating the mental health system is also another issue for most of our young people. So a lot of those barriers are eliminated just by having somebody to just listen and be that coach, so to speak, as young people describe kind of what happens for them here. So, you know, I mean, I think the nature of the program by itself is just low barrier, so that we're really excited about that, and that makes it work. And so in terms of the kind of the success story, I think just again, I'll share an example in that person at Avenues. Even as we actually had services there, that we could see that person really flourish and kind of build her life in the way that she wanted. But the most recent experience also at our Andayang has been where I think a senior in high school had been just really depressed and anxious about some of the things that are going on in life. And so the fact that she had someone to talk to, couldn't focus on work, you know, around school. And of course, through this pandemic, we haven't even talked about this, you know, in relation to this, but there was just a lot of things going on. And so having that, that person to talk to on a regular basis and really have her experience or understand her own strength and confidence, and also normalize the anxiety and the depression around this time for many different reasons, really helped her kind of focus on the, you know, how to prioritize and kind of do schoolwork, and really doing amazing right now. And just so grateful for just that opportunity as young people. We complicated through the systems, but for young people, it's having someone to talk to and having someone to you know, to listen. And so we are seeing that already in the very few months that we've been doing this work. So it's really exciting.
Thanks so much, Hannah. I think Emilie, would you want to share next?
Yeah, so our program, I mean, just like the other individuals have shared, the first thing that we really want to do is build rapport and focus on engagement prior to the formal initiation of services, especially for young people maybe who have had experiences with a therapist in the past, maybe that didn't go well, or maybe they have never even had any formal mental health services. And so just kind of getting to know myself as a person rather than, you know, a therapist is kind of sometimes a scary word sometimes. And so getting to know each other has been really, really fun, and, you know, getting engagement in other ways besides strictly therapy. And then other barriers that we've been able to kind of break down. The shelters have phones and computers for use in private spaces for when we do have to do that telehealth opportunities, you know, those are provided for the youth as well. And then the barrier of transportation is not really there either. I'm able to go to visit with the individuals face to face for both the therapy and the support groups that we have. The youth are really, really craving that interaction, that face-to-face interaction. And so that gets them engaged more as well, because staring at a screen, as we all know, can be really hard. And so having that interaction has been really helpful in these strange times of COVID. And I guess some success stories. So I started a support group a couple of weeks ago, which I kind of mentioned, and the youth, they have been really excited to do different activities and things that I'm bringing to them. And they've said themselves that this was something that they had received in the past, some of these individuals, and that was something that they were really missing and craving. And so, yeah, it's been really fun to come with different things and then also hear their, experiences and even how they view the world, and different things about that. So yeah, it's been, it's going well. We're having fun.
Thank you, Emilie. Christina, would you like to share next?
So like Hanna and Emilie both said, transportation, the lack of insurance or the ability to have payment is a huge barrier. But one thing that I've really seen too is our young people, until they feel safe, they're not going to open up to somebody. So if they're in a safe place and we're providing those basic needs, they're going to be able to be a little bit more open. And Emilie touched on this as well about developing those relationships. So from a trauma-informed lens, just being able to trust is built at the, relationships are built at the speed of trust. And so with that, having somebody on site and taking it step by step, maybe it's 15 minutes for the first few weeks while they build that out, and that realize that person's not going anywhere and they're there regardless of what the youth says and all the different trauma. They're there as that support. So I think that's been really helpful. So I think that is even more. I mean, the monetary piece is obviously huge. The shelters that couldn't probably do this obviously without the support of DHS and being able to do the monetary piece, but just the in-house having those services for the youth has just been really, really important. And for us to get past that barrier versus, dropping them off somewhere that they have no relationship and then picking them up in an hour and hoping that it goes well, and they may never even talk about it. So we've definitely seen this program being able to remove some of those barriers. As far as success stories, we've seen youth that have been in our shelter, both the Safe Harbor and our homeless shelter, continue services on with the providers. So they've been able to build that relationship and continue on to help some stability. So that has been helpful. And then also, I think in the case, especially in our Safe Harbor shelter, with some of the complex trauma that comes with SEY, we've been able to better serve the girls and the youth because we've been able to have those client consults. So I really think that's a success. So we've been able to meet the needs of the girls better and keep them longer because some of that trauma is real high, and that might result in escalation. Staff may not understand that, but that has been a real success for us. I think just being able to understand better of some of those traumas and how we can meet them where they're at has been huge.
Thank you, Christina. All right, so we can move into the next set of discussion questions that we have. And the first question, we just shared some of the successes that you all had in the program. So along with that, what are some challenges that you all faced in providing shelter-linked mental health services? Especially because ramp down was happening while the pandemic kind of was, starting. And so just really speaking to some of those things that you all have experienced. And then as a last question, what advice would you have for other providers thinking of integrating mental health services into their homeless assistance or housing services? And we can start with Christina.
For us, sorry, there we go. Some of the challenge when we first implemented this, that just really bringing our direct care, our youth advocates up to speed, that this is part of our program and not just one-off thing. We really wanted it to be all encompassing of our programming. So in the very beginning, it was, we offer all of these basic needs and these things. Oh, and you could see our mental health therapist. And so not all youth are like, well, no, I don't want to see a therapist. So now when in our conversations at intake, it is really part of our program. And obviously they always can still decline and they may have a therapist, but it's built in more. And so kind of that mindset shift with our youth advocates, that it's really important to be talking about it with the youth and families if they're involved, that this is a huge resource for them. So that was us just kind of building into our process. And so the sooner that process that can be implemented in each of the programs, the better. And then the second piece is just like that clear documentation between the providers. We work with 2 different providers, trying to make sure that, because there are, with any grant, there's some obligations, making sure that that if the youth does have insurance, that we've got that information. We've tried to bill insurance. Have we accessed MA? What does that look like? So again, so just more process things for us that just needed to be worked out. And now that's a little bit more streamlined. It's in both shelters. It is part of the program and going really well. And we're excited to see how it grows and that hopefully that more shelters and programs can gain service like this.
All right, thank you, Christina. Emilie, do you want to go next?
Yeah, so similar to what Christina touched on, just getting integrated into the programs because it's a completely new position. And so the staff aren't used to having, a mental health professional around. And so kind of understanding even for them what that means. And then getting that into the programs themselves. And so I guess I would suggest just having a plan with getting the behavioral health provider in on team meetings as early as possible to help staff understand the role of the provider in order to help get connected to youth and really making that just part of the program. Another barrier is just COVID has caused a lot of transitions, wondering like, limiting numbers of people that can be met with. And so just, the health and safety of everybody. And just, coming up with really, really creative ways about how to get youth engaged has been interesting. But it's moving forward and everything. So it can be a challenge, maybe a little bit up front to get that engagement, but then just keep on pushing forward with that. And then, so the 2 programs that I work with too, one of them, the one program has just 2 individuals that live there right now, and the other program has 10 individuals that live there right now. And so trying to coordinate for me to meet with everyone has been kind of tricky, just because with 10 different schedules, that can be really hard. And so I've just started setting aside different times of the day specifically so that they know when I'm going to be there and having that consistency, and then they know what to look forward to as well. So flyers are really helpful for that sort of thing. That's kind of what I started doing as well. But yeah, bringing food as well. Snacks are always really enticing and just some sort of fun activity as well. So just being creative.
Thank you, Emilie. Hanna?
Sure. I think both the panelists have talked about this, but the challenge is really that as we see it, of course, you don't start a program during a pandemic, right? It's just lots of challenges there when you are truly wanting to be there for young people and having to adjust services, not in the way that you planned it, but it has to be different. And then also trying to figure out, is it telemedicine, or is it, person, distance, when it gets cold, how are you going to adjust? I mean, just a lot of the things that are unknown that came through this pandemic. Really the biggest challenges that we have. And I think it's also what's also in this is the world is changing, right? So looking at, therapy or mental health services are about holding hope for young people. And when it feels like nothing is certain or we don't know what's happening, and then everyone being on the same boat and really staff trying to show up for young people at this time, sometimes it just feels kind of, different, right? Our staff kind of, we're all in this together is really true in the sense that we're all dealing with it. We're all feeling it at the same time. So being able to be there for young people is a challenge. It has been a challenge because this pandemic and many different things have changed our world. And so just acknowledging that, and how do you also hold that space for young people? It's been kind of very interesting for us to navigate. And I think the other piece is about time, right? It takes time to build anything meaningful, and so being able to create that time is, we not having enough time to do this during this pandemic again. So it's really about how do you truly create something that works. And it seems like this pandemic kind of stolen that opportunity, from us. And also the nature of this grant is about kind of time limited too, and the success. Hopefully, the kind of information from the success would inform future grant making. And so, my worry is that that this does not become kind of the defining moment for whether this is effective or not. I think this is something that is so valuable for youth in shelters that it's this is not the right time to gauge whether this works or not. So I think I want that kind of to be registered in that. So what we have seen is, with the challenges, again, it's like, how do you talk to young people when all these things are really upside down for them, and yet there's so much trauma, personal trauma they're going through, to the reason they are in the shelter. Navigating all those things has been really a challenge. I think also the advice, or what I would say to other providers is it takes time to engage with young people. It takes time to set up something. So really make sure that it is okay to take time with young people, and also the kind of lowering your expectations around therapeutic goals. And I think this is a huge piece that we have learned, that it's if it's about basic needs, if it's about the things you haven't imagined, it's really not something that you can put in on the treatment plan. It is okay to go with whatever is presented. And I think, we may have different expectations coming in because we all want to do good work, but really it teaches us how to kind of listen and watch what's happening with young people, and kind of have some manageable kind of expectations, and also really help them understand how to manage their own expectations on themselves as well. So that's something that we have learned again. So I just want to caution at this time too, like what I would say to our friends at OEO is that really hopefully looking at the long-term impact of this, and having an extended period of time to have this work well. And of course, the short-termness of all it is also have made it a challenge to also hire staff too, qualified staff. So that's also something that works in the system, and something for us to think about as we go forward. But it's such an integral service, being able to provide access to mental health services in meaningful ways, lower stigma for young people, and having it available when they're waking up in an environment that they're not sure what they're doing, or really the unstable nature of their life, and being able to be present for them is such a huge honor for youth work. And this is something that we're very excited to do, and we want to continue doing it. So I thank you all for the opportunity.
Great, thank you so much for that. We have had a couple good questions come in, so I'm going to read off one of these questions and have you all respond. And then there's another one, and if anyone has other questions, feel free to send them over. So we got one question that says, could you please share what training you provide for shelter workers and case managers regarding trauma-informed care? So whoever might want to respond to that, you can feel free to go ahead.
For 180 degrees, especially for our safe harbor shelter, we work a lot with Caroline Palmer on delivering trauma-informed training. And then we're a grantee of supportive services through Safe Harbor. And so part of that money, we hired a trauma-informed consultant to look at our program from bottom to top, side to side, how we interact with our staff, with our youth, how we serve them, and then looking at training to meet the youth where they're at. And so it's a very beginning stage for this consultant of a 2-year project. It is not a one training and done. It is definitely something that has to be very intentional, and a lot of work needs to be put on it into it continuously, because being trauma informed in so many different situations in a shelter, when you're dealing with youth that are experiencing different crises and trauma, can be very hard. So making sure that we provide as much support to our staff and resources as possible, to be able to, do the day in and a day out.
I could just add to that too. At face-to-face, what we find is, I think just a lot of us, especially with trauma-informed care, is something that we use and really talk about, but really in practice, it's hard to understand and implement. So what we found is that just what does it mean in a day-to-day programming and a day-to-day existence of programs? What does it look like? How do we make decisions based on knowing and understanding the trauma history of our young people? So it has been kind of the practice or the implementation of some of these theories that we have has been the opportunity for us to kind of to talk through. And of course that comes with the needs that staff talk about, and kind of processing, going through some different challenges that they have seen. Just that staff consult when they bring things to the mental health practitioner is how we've seen the trainings work. And also the 9 principles to overcome homelessness is also another one of those principles that we talk about. And so again, the implementation, the practice of those things, and de-escalation is a major part of it too, as also Christina said, but the self-regulation that's needed in order, when we work with young people, it's not always about regulating, it's not about regulating the other person's emotion, but how do we, as staff, and particularly in shelters who deal a lot of kind of ongoing escalation, how do we manage our own emotions as we show up for the young people? So that's part of the trainings that we give as well.
That's great. Emilie, I don't know if there's anything you wanted to add to that, or there are a couple other questions too.
We can move on to other questions, that's fine.
Okay, so another question is, how do you integrate culturally affirming practices in your approach?
Can you repeat that question one more time?
Sure. It says, how do you integrate culturally affirming practices into your approach to mental health services?
So I think the basis for us at Face-to-Face, the basis of how we do our work is really, it's not about cultural competence, because no one person can do that. We really talk about listening and understanding and being curious about the lenses that our young people present to us. And so really meeting their needs based on their own context, and also educating and informing ourselves on what that means. I think so affirming, like we work with Diane as well as avenues, we starting that work. So it's really about, what do the young people bring? How do we listen for it? How do we hold space for that? And how do we also, if there are other healing modalities that they want to explore, and how do we make sure that happens? And Diane is a really good place for, for the color affirming of the cultural components of our young people. So it's really about having that lens for us. How do we have that? How do we check our own assumptions and make sure that that doesn't get in the way in the therapy session? It's really about listening for the young people.
I don't have anything to add to that. I think that Hannah did a great job summing that up.
Okay, great. We did get another question, which I know all of you are serving youth, but this says, how do you approach providing services to youth versus providing services to adults? Is it a different experience? I don't know if, I know all of you are kind of working with multiple programs. I don't know if your programs have different age ranges. I don't know if there's anything anyone would want to share about maybe different approaches you take with people of slightly different ages.
Our Hope House shelter does serve youth ages 14 to 19. So we do have young adults in our program there. And the only thing, the difference really at the surface would just be, you know, that instead of having a parent or guardian signing off on the things, it's engaging them, you know, as a signer. I don't offhand, I have not seen any differences engaging, you know, maybe our younger youth might be more willing to see someone, so it might take a little bit more time to engage and build that relationship, because the older young adults may have had more experiences with working with therapists, or just even just trusting adults in general.
Kind of along those lines too. I mean, just the life stages and what they're going through. I mean, we work with ages 16 to 24. So they're young adults, not, you know, older adults, you know, in their 50s or something. But, you know, people in, you know, ages 16 to 18, they're in high school. And so just looking at kind of their responsibility and what they have, you know, what they have to do for themselves versus those, you know, legal adults, the 18 to 24-year-olds, you know, different things that they are going through, and, you know, all that more responsibility that's being put on them. You know, certainly these individuals are more independent than other people are just because they are homeless. And so, yeah, just kind of looking at the developmental stages and where, I guess, what their needs are at that time.
Just a quick thing to add to that as well. I think both have talked about this, but I think the difference for us is when we look at age sometimes just is a number. So we look at, as Emilie said too, like the kind of the developmental issues that are there for young people. And so really meeting needs where they're at. And I think, you know, our young people, again, have experienced so much complex trauma. So there's this maturing in a way that, you know, they're kind of growing up too fast, and we're forced to grow up too fast and really deal with a lot of things that most adults didn't deal with at their age. So we're looking at, and so of course that has an impact on the brain, and also the things that are basic sometimes when we talk about this. So it's really about who do we have in front of us, what has happened in their lives, and what are the things that they're their strength and really good at, and what are the challenges that they're facing. How do we work with both? And I think that seems to work, and for us also is the young people come to service providers to engage at their deficiencies or what's missing, or you know the problems they have in their lives. But really, how do we focus on, again, regardless of, you know, age, how do we focus on the strength that they have, you know, and so engage them at that level so that they can actually build their confidence and really know who they are. So it is important for us to focus on that piece too, regardless of age. Yeah, we've served young people from 11 to 24. And really, there are lots of different ways that the chronological age shows up. But if you really focus on, like we said, like the developmental issues that come up, and especially the impact of trauma on our young people.
Great. Those were all the questions that have come through so far. I was thinking about one other thing that I think might be helpful for the participants to hear. I know with face-to-face and LSS, you both are mental health providers within your own agency. But I know with 180 Degrees, you all are partnering with community-based mental health providers. And that's kind of a foundational piece of Shelter Linked, is to make sure youth are connected with mental health providers that they can continue to see long-term too, potentially. So I was wondering, Christina, if you could talk a little bit about how your experience with how you decided to partner with the mental health providers that you're partnering with, and maybe what your experience has been with them. How did you determine that they were appropriate for the populations you're serving? Things like that.
Absolutely. For Hope House, and that is in Chanhassen, Minnesota, so a suburb west of Minneapolis, for those that are not familiar with the western suburbs. We partnered with My Health Teen Clinic, and the reason we had already built a relationship with them because they provided our health assessments when our youth come to our program. So we had already been working on that relationship. And prior to this grant even coming out, we were in some discussions of how we could meet the needs of the youth through mental health. So we had kind of a grassroots, way smaller version. I had hit the pavement and got some small grants to be able to provide some of the, reduce some of the costs. So we had done that there, and that relationship just has really grown. Two small programs that have worked really well together. And at the end of the day, finding a provider that has the same kind of goals, if they're, being trauma informed was really important to us. Working with youth was also really important. There's a lot of mental health providers out there that are really good, but not a lot of experience with youth, and not a lot of experience with youth in crisis, or with working with diversity. And so that was important as well. For Brittany's Place, our senior program manager at the time had built a relationship with Natalis Counseling. And so they kind of just started talking about it, and then we met as directors with Anne there and built out that relationship, and that has also been a great fit for that specific SEY shelter. So I really think it's about relationships and having the same end goal.
Great, thanks for that. We have just a couple minutes left. I guess I just was wondering if anyone else had any last thoughts they want to share, or Rabya, if there's anything else you wanted to add.
I don't have any thoughts. I'll give it to the panelists if they have any last thoughts.
Did I just say that this is such a critical program, and I will I want to repeat that because as somebody who really fought to make this happen early on, that it is such a vital thing to have access to mental health services, which sometimes is a luxury for many of our young people to have in a shelter with young people experiencing homelessness. So whatever we can do to make sure that this happens and exists in many housing programs would be something I would really recommend. Not just shelter, but also housing with mental health services, as we know, is renders success. So just want to encourage DHS to look into that.
Great, we hear that loud and clear.
Thank you.
Well, thank you so much to all of our panelists. It was really great to hear your experiences and have you share your expertise. So thank you so much.
We really appreciate you. Thank you.
We really do, yeah.
Thank you.
I don't know if there's anything from the coalition, but I think we're wrapped up with our part.
Great. Well, thank you all for participating and sharing your insights. It's been a great session, and I've learned a lot about this program. So thank you. I just want to remind everybody, on all the participants on the call, that we have our 2 sessions tomorrow coming up. The first one will be using the homeless study to inform policies and services, and our 11 o'clock session will be an overview of the housing stabilization program from folks at the Department of Human Services. So we hope to see you back again. Thanks again to our panelists and for everybody on the Zoom webinar. Have a great day.